Hi, everyone. My name is Caitlin, and I'm really excited to be here with all of you for my final semester of this program. My nursing background includes both bedside nursing on a neurotrauma floor. I worked at UMass, the university campus in Worcester, so a level one trauma center, and also as an advanced level nurse injector in aesthetic and wellness. So, because of that, I'm really passionate about preventative and holistic healthcare, and I'm excited to keep growing with you guys throughout this final semester. So, working on a neurotrauma floor has taught me so much about critical thinking, communication, patient advocacy, and staying calm in high stress situations. I also work in that aesthetic and wellness setting where there I focus more on helping patients feel confident while also educating them on overall wellness and lifestyle factors that can affect their health. And a big personal interest of mine is health and fitness. It always has been. That was kind of my why before nursing was my why. Um, and I really enjoy learning about nutrition, hormones, gut health, and sustainable lifestyle changes that can improve quality of life. A fun fact about me is that I also have a 9-month-old son, Lucas. I took a exam 2 days postpartum, so balancing schoolwork and motherhood has definitely kept me busy these past 2 years. Throughout this program, I completed about 315 clinical hours in primary care, family medicine so far, and I'll be completing an additional 300 this semester. My primary care experiences have really reinforced my passion for preventative and patient-centered care. And I've really realized how important patient education and also patient rapport and relationships are, and how many patients are truly looking for providers who take their time to listen, educate, and look at the bigger picture of their health. However, throughout this experience, I've also realized that to practice the way that I'm passionate. I don't know if primary care will be my ideal setting, as insurance boundaries, time constraints make it not that these providers don't want to, but that they physically can't. So because of that, I'm especially interested in that preventative and more integrative style care. The areas I'm most passionate about include nutrition, lifestyle medicine, hormone health, gut health, physical activity, and helping identify nutrient deficiencies, also sleep, just general quality of life. Also, mental health. If I were to ever go back one day, which I say I will never, it would be for my psych NP. I think many patients want more guidance on how to improve their health before chronic disease develops, in that there's just kind of a missing level of our healthcare system where primary care is at the bottom of the pyramid, but they don't actually have time to focus on a lot of the first step lifestyle modification treatment recommendations and actually educate and help people practice that first treatment recommendation. Um, and I love that idea of helping patients make sustainable changes that improve how they feel both physically and mentally. After graduation, I'm still keeping an open mind, listening to all the offers, all of the advice that's coming in. Um, Definitely a stressful semester as everyone keeps asking me where I'm going, what I'm doing. And my brain's one place, my heart is one place. So trying to navigate that for sure. I do see myself in primary care, like I said earlier, women's health, wellness, or a more preventative and integrative style practice. My goal is to combine evidence-based medicine with preventative care and patient education. I really want to help patients feel empowered, and not only in their healthcare decisions, but also in building strong long-term relationships with them. I want to be someone that they can actually trust and go to when they're starting to struggle or when they feel like they're struggling. One of the patterns from the circle of caring model that stood out to me the most was authentic presence. I think a patient can immediately tell when a provider is truly listening and genuinely cares about them as a person, not just as a diagnosis or an appointment. And I've gotten very great feedback from patients in primary care. My preceptor has very impressed with me because of that regard. And I think a lot of that comes from being in the aesthetic space where you deal with a lot of body dysmorphia, and using education, anatomy, facial aging patterns, kind of more objective data to not only reorient them and find a way to boost their confidence and their well-being, but also take a deeper look at kind of their mental health and aiding them helping them navigate that aspect as well. Um, I want the patients to feel heard, comfortable, and supported. And I think building trust and creating a safe environment for patients is one of the most important aspects of healthcare. So thank you all for listening to my introduction. I'm looking forward to getting to know everyone better and continuing to learn throughout this final semester.